Hey everybody, it's Dr. Reiser. If you like what you see in our videos, make sure you click subscribe so that you don't miss out on any future videos about functional medicine, nutrition, and tips on how to reclaim your health the easy way with Functional Health Center of the Carolinas. Ready to another Whiteboard Wednesday. It's Dr. Reiser, and it is Heart Health Awareness Month, obviously for February, so we're going to be getting into a lot of cardiovascular related material, and starting with the biggest of them all, which is right behind me, cholesterol, HDL cholesterol, LDL cholesterol. You could even lump in triglycerides if you wanted to. Everybody comes in or messages us or researches online about what is the optimum level of cholesterol, how can I get my cholesterol down naturally, do I have to take a statin, and why is my doctor constantly pushing me on a statin when my neighbor down the street has higher cholesterol than me? So it's a hot topic. The research is all over the place as far as what's coming from conventional medicine side and functional medicine side. But today's video is going to be about what a lipid panel should tell you, what are the risk factors for cardiovascular disease. And this is not for somebody, this video is not for somebody that's 50 and older, 60s, 70s. This is for everybody because you obviously want to start at young, 20s, 30s, preventing any kind of cardiovascular issues. And at the end of this video, I'm going to give you the one test that you should actually know that tells you and predicts your cardiovascular list, along with a few other ones that you want to sprinkle in there. But this one is not related to what you're always going to see on your lipid panel, the LDLs, the HDLs, and your total cholesterol. My biggest gripe with cholesterol, as far as coming from your conventionally trained doctor, is people will slide their labs across the desk to me and say, my total cholesterol is a 220, my LDL, my bad cholesterol, which we're looking at right here, is 120, and they are very mad at me because I don't want to go on a statin. They're pushing a statin drug on me. Well, rightfully so. A lot of the conventionally trained doctors are going based off of statistics, and right now in the United States, every 39 seconds somebody dies of a heart attack. And we have somebody, or have, I think it's 63 million people right now that have cardiovascular disease. Over 1 million people, die each year from cardiovascular disease. But is cholesterol the problem? There's many different risk factors for cardiovascular. The two biggest things that will put you at the greatest risk for a heart attack is blood pressure and smoking. Has nothing to do with your cholesterol right now. So we have these people come in, and the first thing that I will tell them, especially if they're around the ages of 70 and older, because there was a really good research article that came out that showed that people that were 70 and older, if they kept their total cholesterols between 160 and 190, they actually had a lower risk for heart attack. And the people that were below 160 actually had 2 times the risk of having a heart attack. So lower doesn't actually always mean better, and time again, we'll see your doctors put you on statin drugs to lower your cholesterol, and you'll come in with below 150. Well, that actually puts you at a greater risk. You need cholesterol. So let's look at it here for a second. So I've drawn the molecule up here, and most people think cholesterol is fat. That's not true. It's a steroid and alcohol mix called a sterol, okay? And actually, cholesterol is important for your body because it makes a lot of your other hormones. And that's why you'll see with people that have low cholesterol, or you're taking a statin that pushes it very far down, you'll have fatigue and all these things that are coming along with it, because generally all your other sex hormones will go down. And really your brain, think of your brain is mostly made of cholesterol. So you need this to have your brain function. And that's why we're seeing the big connection with statins and dementia, memory loss, brain fog. The other alarming statistic about statins is if you take a statin, and it could be the lowest dosed statin, 5 milligrams, 10 milligrams, you're at a 38% greater risk of developing type 2 diabetes. So my diabetics that come through the office, I ask them, have you been on a statin, or were you on a statin prior to developing type 2 diabetes? They go, actually, yeah, my doctor put me on because I was slightly high. He said it would help me, it would keep me healthy. Well, majority of the studies that come out show that statins, if you don't have any kind of pre-existing risk for cardiovascular disease, don't fix really anything. Don't prevent any heart attacks. So if you can, go through your life with avoiding statin drugs, absolutely try to. There are some exceptions, obviously, and that's what I'm trying to tell you today in this video, is there's going to be multiple different things you have to look at to assess your risk. You could have 5 out of the 6 things perfect, and you have one marker that might be a risk factor. That doesn't make you at high risk for a cardiovascular event that you have to go on a statin. So have this education available for your doctor so you can make an informed decision whether or not you do need to be on a statin, okay? So when we look at these, the real situation about cholesterol is not exactly how much cholesterol do you have. There's multiple risk factors, But the one test you want to get done to tell you your exact cardiovascular risk based off of your cholesterol is called your LDL particle size and particle number, specifically the particle number, okay? So most people say, well, I know LDL, I know that's the bad cholesterol, but what's the LDL particle number? So your cholesterol, your low density lipoproteins, excuse me, that's gonna be your cholesterol floating around. But the problem is those actually aren't the things or aren't the molecules that are damaging the arterial wall, it's the particles. So for your LDL cholesterol, HDL, for these to float through your bloodstream, they have to be carried by a particle or a lipoprotein, okay? So that's what you want to see. If there's more particles, it's a more likelihood of you to damage your cardiovascular system. So you can actually have high LDL cholesterol and low LDL particle number, which puts you at a safe level. You're not at a high risk for cardiovascular event. So that's the test that you need, okay? And I'm gonna write this up here so we're sure that we know it. So next time you're at your doctor, or if you come to us, we can easily run into a very simple cash pay lab, is your LDL particle number, okay? That's what you want to look for. The particle number is going to tell you how much low density lipoproteins are floating around the bloodstream that could potentially damage the arterial walls. And so that's what we're after. That's the number one test to tell you. Now, other tests, I'm going to get a different marker here so we can see. Other tests that are going to assess your cardiovascular risk, okay? Here's what I tell my patients. Number one, get a C-reactive protein. So this is going to tell us how much inflammation is in the cardiovascular system, and it actually will say on the lab your relative risk for future cardiovascular event, high, average, low, based off how much C-reactive protein is floating around the bloodstream. That stuff also nicks the arterial walls and can cause plaquing, and that's not what we want. The other thing I want you to look for is fasting insulin. So fasting insulin is a big time indicator of cardiovascular issues. What will happen is if your insulin is going up, or if you have a lot of insulin in your bloodstream, that increases your blood pressure, which, as we know from the beginning of this video, blood pressure is a major risk factor for cardiovascular disease. Not to mention, obviously, if you keep your insulin high enough in your bloodstream and it's too high, you will develop insulin resistance, metabolic syndrome, type 2 diabetes eventually. So that's another test that you have to see. You also want to make sure you look at your homocysteine levels. So homocysteine is something that needs to be broken down by vitamin B12, and if it's high in the bloodstream, that actually is another risk factor for cardiovascular disease. So it tells us also how well you're absorbing and utilizing vitamin B12. A lot more accurate, in my opinion, and many doctors' opinions, than just looking at your vitamin B12 in the bloodstream. This molecule has to be broken down by B12. So if it's high, that means you're not utilizing it properly. Another risk factor, obviously, we're going to look at would be your triglycerides. And then I always like to look at your total cholesterol to your HDL ratio, or even just your triglycerides to your HDL ratio. But you have to have your HDL cholesterol. And time again, we will see people come in with low HDL cholesterol. That's your good cholesterol, okay? To raise that, exercise helps, omega-3 fatty acids, eat more fish, get your fish oil in there. But the HDL cholesterol here, if it's low, again, we're talking the lower amount of cholesterol actually improves, or not improves, but enhances the risk of developing any kind of cardiovascular event. So those are things that I've taken into account if I'm looking at your risk or your risk factors for cardiovascular event. One question I always get from people is, I'm nervous about eating fat and I'm nervous about eating cholesterol. Well, time and time again in most studies, at least 70% of people are okay with eating eggs and these types of things. So please continue to eat the yolks in your eggs. Yolks have a high amount of choline. It's a vitamin that maybe about 90% of people are probably deficient in. It's a B vitamin. So the dietary cholesterol that you're getting from your diet really has little to no effect for the majority of people on their actual cholesterol. Your body will either make cholesterol on its own or use the cholesterol from your diet to keep things level. It's only when these things are out of balance where your cholesterol will go up. But really having high cholesterol, let's say you come back and you have a 250 total and a 150 LDL, none of those or neither of those two things, as you can see, are part of our risk factors. I need to know your LDL particle number if I'm going to actually figure out if you are at high risk for a cardiovascular event. Here's a couple things that will actually raise your particle numbers, and that's what we'll start to work on if we do indeed see your particle number being high. So let's take a look at this, because we have plenty of people, and we've addressed this in a video before, where we talk about thyroid. So your thyroid, and specifically TSH, if that number goes high, your TSH, I'm not talking about the thyroid going high, I'm talking about the thyroid slowing down. If the TSH goes high, you will produce more cholesterol. Okay, so even if you have subclinical hypothyroidism where the T4 and T3 are normal, but the TSH is slightly high on a functional range, not even a lab range, you will produce more cholesterol. That's actually why in the very beginning, when they started to look at cholesterol and LDL particles and those types of things for cardiovascular disease, the first intervention was actually thyroid medication. So that's one thing we look at. We talked about this other one in the last video. We have your H. pylori. They're finding that H. pylori infections are causing cholesterol issues. And then obviously we transition into leaky gut, causing cholesterol and LDL particle number to go up. And really the last one, and this is the one that most people don't want to hear about, but it is genetics. So genetics can play a part. Obviously we have a familial issue with hypercholesterolemia, and we will take that into account, but it's not a death sentence. Most people think, well, if everybody in my family has a cholesterol issue, then it's going to be a problem for me. And the problem with that whole, mindset really is the fact that you never know. If you have people through your family that have cholesterol issues, who knows if every single doctor diagnosed them incorrectly, and when you looked at all their risk factors combined, they were actually on the low end of risk, and they were put on statins unnecessarily. So that's what we want to talk about, and that's what this whole video is about. We'll put a caption together, and I'll put a couple articles on there. But really, it's to tell you to assess every single piece of information you have to really show whether or not you are at high risk for a cardiovascular event. Too often, we have doctors saying, oh, as soon as that cholesterol goes over 200, we have to put you on a statin. And if we know anything about statins, I mean, all other places in the world are starting to ban these things just from, all the issues we have, increased mortality risk, dementia, diabetes, kidney issues, muscle issues. I mean, you name it. You don't want to be on these things if you can help it. So assess your risk factors. Look at the things that we talked about earlier in the video. Look and see if you have any of these issues. We can test for these, obviously, thyroid, H. pylori, do a stool analysis for leaky gut. We can even check your LDL particle number. That's the #1 test I recommend. Looking for lipoprotein A. That's probably if we're talking about anything that's going to tell you your exact risk, lipoprotein A is the thing that you need to take care of as far as a test, and you'll have a much more predictive marker or result from that marker. But there is no one marker that's going to tell you whether or not you're going to have a heart attack, cardiovascular disease, or anything like that. So don't just take the statin thinking that this is it. It's going to save your life, because there's plenty of people that are on statins that still have heart attacks, still have strokes. So assess all information. If you have any questions for us, we're going to be going over a lot more of this information, because obviously Heart Awareness Month, we can see from just this video I've been rambling on for about 13 minutes, is that there's a lot of information. And even just this 13-minute video, I just barely scratched the surface, went all over the place in direction as far as what we're talking about. So DM us, comment things that you have. But to wrap this up, you need your lipid particle number, your LDL particle number to see if you have a risk, lipoprotein A, fasting insulin, C-reactive protein, homocysteine levels, triglyceride levels, what's your total cholesterol to HDL ratio. If you need to push your HDLs up, get out there and exercise, use your muscles, omega-3 fatty acids, and then after all that, if you still have high issues with your particle number, assess these, because they lead to particle number increase. And then a functional medicine doctor like myself can start to work with you in various different ways with your diet to start to bring those down. Don't be afraid of fats in your diet. Do not be afraid of cholesterol in your diet. They are good for you. Like I said, in a majority of studies, cholesterol in your diet, saturated fat in your diet had no issues or little to no increased risk for cardiovascular disease or stroke. Look these up, they're everywhere. But if you, like I said, if you guys have questions, we'll be going over a lot more information. Hope you have a great Wednesday, and be on the lookout for more videos like this for Heart Health Awareness Month.